One of the most important decisions to make when having a baby is where the heck are we going to have this baby? Are we going to have it at home, at a hospital, at a birth center? In today's video, I'm going to talk all about why I chose to have my baby at a birth center, kind of the differences between birth center, hospital birth, home birth, and what I would do next time. If you're new here, my name is Maggie Moreland and I am a certified holistic health practitioner. I am currently 26 weeks pregnant. I used to share things all about women's health and wellness, and now I am sharing all about my journey with baby number 1. So if you're interested in following along with this journey, please go ahead and hit the subscribe button so that you can see my latest videos. So I have some notes down here that I'm going to be referring to throughout this video. So if you see me looking down, just checking out the notes. As I said, I'm going to be discussing why I chose to have my baby at a birth center and kind of the differences between the options that you have when it comes to where to have the baby. It's kind of like the biggest decision that I feel like I had to make in the first trimester, is like, where am I going to have this baby and who is going to be providing care and support for me throughout this journey. So I decided to go with the birth center because I've always been interested in having an unmedicated natural birth. And because it is my first baby, I was a little hesitant to just going straight to having a home birth. So having a birth or having your baby at a birth center is a more home-like environment instead of a hospital setting. So hospital rooms can be kind of mechanical, and you have tons of machines and beeps and noises and fluorescent lights and not comfortable furniture, and it's very sterile environment. So I wanted something or an environment that felt more like home to me, and birth centers typically provide this home-like environment. So there's typically, in your room, you have a bed and chairs, and the lighting is more calming, and you have like a window, and you have your own bathroom, and there's also a kitchen available to you, a living room available to you, and some birth centers even have other areas like gardens that you can labor in if you'd like. So I knew that I definitely wanted to be in a more home-like environment. That was kind of number one for me, because one, hospitals kind of freak me out. I've had some bad experiences, I guess, at hospitals, so I didn't want to take that negative idea, I guess, of hospitals into labor with me. So I figured a completely different environment would probably be best. Another difference between birth centers and hospitals is the people who are taking care of you. So typically at a hospital, you have your OBGYN caring for you. And if you have an OBGYN that you've gone to forever and you love, and they know you and they know how to take care of you, I would say just stay with them as your care provider and have the baby at the hospital. You can still do a lot of the things that you can do at a birth center now at hospitals, which we'll get into later. For me personally, I don't have an OBGYN that I've been seeing consistently over the years, so I haven't built up that kind of relationship. So I knew that I wanted to go to a place where the care provided was more holistic and was more client-centered. And at birth centers, typically the care is provided by midwives, and their model of care is a little bit different than the typical obstetric model of care. So it's very client-centered, and they really want you to be empowered in your decisions, informed and empowered. So there's a lot of education involved and a lot of conversation involved. It's not just somebody telling you that this is what has to happen. It's more of a conversation between you two, figuring out what the best decision is for you. And I really like that. You also have nurse practitioners at the birth center to do like blood work and things like that, and really make sure that the baby, is healthy all throughout your pregnancy. So at my birth center, the midwives are certified nurse midwives. Some states don't require the midwives to be certified nurses, but in Pennsylvania, they are required to be a certified nurse. So they do have a lot of education about the physiology and the actual medical side of birth and labor, as well as the midwifery model of care, which I really like having both of those kind of knowledge bases. I feel like is really, really important. One downside, I'd say, with the midwifery model of care, at least at my birth center, is you have a team of midwives and nurse practitioners. So there's about 10 to 16 maybe different people that I could potentially see throughout my pregnancy. So you have less of like one-on-one with one doctor, and you're kind of meeting all of these midwives and nurse practitioners, because when you do go into labor, the person that will be providing care for you at that time is whichever midwife and nurse practitioner is on call. So they want to make sure that you kind of meet most of the people there and get to know them, so that whoever is on call you maybe are familiar with. The one thing that I have noticed with this is I feel like this birth center attracts a lot of this same kind of person. So I feel like the vibe that I get from one person is very similar that I get from another person, which I really like. And all of the midwives and nurse practitioners that I've met so far have been amazing. So I can't complain at all about this model of care. I thought that I would be more into just having one person, and I thought that I just wanted to build a relationship with one person, but it is really nice to know that I have a whole team of people technically taking care of me at this time. Another one of the big differences between having your baby at a birth center versus a hospital is being mobile. So typically at a hospital you have a fetal monitoring machine, I guess, hooked up to you at all times, and it's just to make sure that the baby's heartbeat is strong and you're not doing anything to hurt the baby. But this requires you to be stationary in bed. You can't really get up and move around and things like that. Some hospitals may do kind of intermittent fetal monitoring now, but that is something that the birth center offers 100%, which allows you to be mobile. So that allows you to labor wherever you want. So you could labor in bed if you want, you could labor on a yoga ball, you could labor in a bathtub, on all fours, any position, which I really like. I like the idea of being able to tune into my body and listen to what my body wants and where my body wants to go during that time. So that kind of was a big no for me when it came to hospital births. Another big no for me is the fact that at hospitals they do not allow you to eat or drink. And I don't know if you guys know this or not, but labor can be pretty extensive. It can be pretty long, and you're gonna get hungry and thirsty throughout this process, and you're gonna need fuel to just continue on throughout this process. So not being able to eat or drink was like, I wasn't interested in, just because I know how important food is for your body. they do allow you at hospitals to drink clear liquids, I believe, and I know some people have eaten before going to the hospital. They only recommend not eating in case you need like an epidural, because they don't want you to like vomit or something and choke on your food. But that kind of leads me into the next thing about the birth center is it is pretty unmedicated. They do have at my birth center a couple pain things that you can do, but there's no epidural and there's no Pitocin. They don't have an anesthesiologist. They can't like hook an IV up to you or anything like that. So that is kind of why, or one reason why they allow you to eat or drink, is because they don't have that risk factor of you potentially getting sick. But also I like the fact that they typically don't use more of these hard or heavier drugs during labor. And I'd say the last big difference between the birth center and the hospital is that after you give birth at the birth center, you're typically allowed to go home within 4 to 12 hours of giving birth, which the hospital you typically have to stay for like overnight, like 2 days. And this is just to make sure that the baby's doing okay, and you know, they want to do a lot of checks and things like that. But at the birth center, they really encourage you to educate yourself, and they provide classes and things like that on how to take care of yourself postpartum and how to take care of your baby postpartum. And because it is because at the birth center they have such little intervention, you typically can go home very quickly. With that though, they do provide home visits. Midwives do come to the home within 1 day or 2 days of giving birth, and they check on you and check on the baby and make sure everything is doing what it's supposed to be doing. Everything is going the way it's supposed to be going, which I think is really nice, because I can't imagine anything being more relaxing or more what I want than going home after giving birth. So that was like a big one for me, is just not having to stay overnight at the hospital. One, I love my bed so much, and I plan on laboring at home as much as possible before even going to the birth center. The birth center is about 10 minutes from my house, so I'm very lucky in that aspect, that I can labor at home for as long as possible and then head to the birth center to just try and be out of my comfort zone or my most comfortable environment the least amount as possible. And then some differences between birth center and hospital that I know some hospitals are more open to, or you know, you can discuss this with your OBGYN, are immediate skin-to-skin contact. I have seen a lot of hospitals, like 100%, once you give birth to the baby, they put the baby on your chest, as well as delayed cord clamping. It is something that can be requested as well at the hospital, but these things are things that you don't even have to ask for at the birth center. It's just like they do that with every person. Like every person is going to get skin-to-skin contact immediately after birth, and there will be delayed cord clamping as well. I mentioned that the birth center has a more holistic approach, so they're more open to doing things naturally and kind of doing things the way that you want to do them. But again, they do provide a lot of education on certain topics to make sure that you feel informed about the decisions that you are making, which I really like. I really like knowing what my options are, but knowing why they are options, you know, like what's the difference between one or the other, and making which one, or making the decision that feels best for me. Like I said earlier, the reason that I went with the birth center is because it's kind of in between going to a hospital or having a home birth. I think next time I have a baby, I will definitely like to have the baby at home. I would definitely like to find a midwife that does home births. If you do find a midwife that is kind of just an independent midwife, doesn't work at a birth center, they typically will only see you, like you will be the only, or they will be the only midwife that you see throughout your pregnancy, so you can build that relationship with them, which I really like. And I also really like the idea of giving birth in my most comfortable environment at home. So that's what I'd probably do next time. I'm really excited to see how things go this time, and I feel really good about the decision that I made. I did do quite some research to make this decision, and I highly recommend you doing the same, because it is, like I said, probably the most important decision that you have to make here at the beginning of your pregnancy. There are only 2 birth centers near me in Pennsylvania. The one is 10 minutes away, and then there's one in Newark, Delaware, which is about 2 hours away. I did actually check out both of them. I went to the Newark Birth Center first, and I didn't have that great of an experience. It was actually kind of traumatic. It reminded me a lot of some experience that I've had in the past at gynecologist's office. So after I had that experience, we decided to check out the birth center more locally, and thankfully that experience was a lot better. I felt that energetically I really vibed with the people that I saw there more than at the other birth center, and the environment just felt more homey and less like a doctor's office, which that's kind of what I was going for. I want something that feels homey and comfortable and less sterile and doctor-like. But if you do decide to have your baby at the hospital, or that is your only option, you can tailor your birth plan to exactly what you want. Like I said, a lot of hospitals are very open to doing a lot of the same things that a birth center can do, like immediate skin to skin, delayed cord clamping, and intermediate fetal monitoring. I know that a lot of hospitals, they do allow you to move around now, but it's probably something that I would voice as something that you want to do if that's the case. But yeah, that is why I chose a birth sitter. And if you like this video, go ahead and give it a thumbs up. The next video that I will be posting is going to be my second trimester recap. I am coming up on the end of my second trimester currently, which is really exciting, and I can't believe that the time has gone by so fast. So I will see you guys next time.